Hi everyone, my name is Dr. Guru Murthy. I'm one of the assistant professor in hematology oncology at the Medical College of Wisconsin in Milwaukee, United States. I would be briefly discussing on this topic, how does pre-transplant conditioning regimen impact GvHD outcomes in myelofibrosis patients? Um, Myelofibrosis is one of the chronic myeloproliferative neoplasms, and transplant is one of the curative treatments for this condition. Unfortunately, GvHD relapse, non-relapse mortality or complications after transplant that we would very much like to avoid and try to improve the success on transplant. When it comes to transplant, there are a few factors that can be modified before transplant and few factors which cannot be modified. Conditioning intensity and conditioning regimen are aspects that can definitely be modified if one has solid evidence to say one conditioning regimen or one conditioning intensity leads to superior outcomes or better outcomes compared to the other. We try to address this question in patients with myelofibrosis because a lot of patients are able to undergo transplant these days because of the availability of many donors and also safer transplant procedures that can also help older patients undergo transplant. So we conducted a study using the CIBMTR database where we included adults aged 18 and above with a diagnosis of myelofibrosis who underwent an allo transplant between the years 2008 and 2019. And we had a collection of about 872 patients who underwent transplant for this condition within the study period. What we tried to analyze is focus mainly on the conditioning regimen that was used in all the different kinds of conditioning intensity that are used for transplanting these patients. So broadly, we divide conditioning intensity into reduced intensity conditioning and myeloablative conditioning. And there are different regimens that can be used within this conditioning intensity in order to facilitate the transplant. So when we focused separately on reduced intensity and myeloablative conditioning and tried to find out which conditioning regimen in each of these settings is associated with a better outcome. So we focused on reduced intensity conditioning, where we had a cohort of 493 patients, and also at myeloablative conditioning, where we had 379 patients. So first, I'll focus on reduced intensity conditioning cohort. So in that cohort, we compared two common conditioning regimens that were used. One is called fludarabine and busulfan, and one is called fludarabine and melphalan. And when we did a comparison based primarily on this conditioning regimen as the main effect, what we found was the fludarabine melphalan treated patients had inferior overall survival, higher early non-relapse mortality, and higher incidence of acute GvHD grades 2 to 4 and grades 3 to 4. And we also tried to analyze a similar question in the myeloablative conditioning, where the two common conditioning regimens that were used were fludarabine busulfan and busulfan cyclophosphamide. So that group had 379 patients in total, and what we found there was busulfan cyclophosphamide was associated with a higher risk of acute GvHD grades 2 to 4 and 3 to 4, and also inferior GvHD-free relapse-free survival, which is one of the newer endpoints that we are starting to focus on the transplantation outcomes these days. The risk of chronic GvHD was not significantly influenced by the conditioning regimen, but it's notable that both in myeloablative and in reduced intensity setting, conditioning regimen with fludarabine and busulfan tended to have a lower incidence of acute GvHD grade 2 to 4 and 3 to 4, and a higher GvHD-free relapse-free survival in the myeloablative conditioning with fludarabine busulfan. So apart from the main effect of conditioning regimen, the other factors that influenced GvHD in this data set was the donor-recipient HLA match. Obviously, the well-matched and the HLA matched siblings are the ones which had lower GvHD as compared to HLA mismatched transplants. And also the pre-transplant ruxolitinib use was a variable that was associated with varying degrees of outcomes when it comes to GvHD. For example, acute GvHD was on the higher side, and chronic GvHD was on the lower side with pre-transplant ruxolitinib with myeloablative conditioning in our study. But again, we don't clearly know how pre-transplant ruxolitinib influences acute GvHD at this point of time. There had also been a couple of other studies that were presented at ASH as a poster abstract, where the role of pre-transplant ruxolitinib was investigated, and it was tied to response prior to transplant. And that response was indirectly associated with whether they have a higher or lower risk of GvHD. So we don't clearly know that aspect at this point of time. we didn't have enough information in the data set to look into those aspects, but I think that's something that would be interesting to know. So I think our study very well highlights that conditioning regimen does have an association with outcomes of myelofibrosis, particularly also when it comes to GvHD. And it's an important aspect to focus on in future studies so that we can have more studies to confirm our results and identify what's the ideal conditioning regimen so that we can reduce the risk of GvHD and improve the GvHD-free relapse-free survival in these patients. Thank you very much for your attention and have a great day.